Hello and welcome to Digital Medbook. Here we go. When a person vomits, hydrochloric acid is lost from the stomach. This leads to a loss of chloride ions, resulting in hypochloremia. Vomiting is often accompanied by dehydration. During dehydration, the pressure in the afferent arterioles of the kidney decreases. This activates the juxtaglomerular apparatus, which secretes renin. Renin leads to the production of angiotensin II, which in turn stimulates the secretion of aldosterone. Aldosterone promotes the reabsorption of sodium and water to help compensate for dehydration. However, it also causes the excretion of potassium and hydrogen ions. This results in hypokalemia and metabolic alkalosis. Therefore, metabolic alkalosis seen in vomiting. Most of the people thinks vomiting is due to loss of gastric acid, which is not a significant component of blood. But vomiting is primarily due to secondary hyperaldosteronism, which is triggered by dehydration. We got a question. Severe vomiting leads to the electrolyte disturbances commonly seen in patients with vomiting include hypochloremia due to loss of hydrochloric acid, hypokalemia due to aldosterone effect, metabolic alkalosis due to loss of hydrogen ions and aldosterone. Respiratory alkalosis is not typically associated with vomiting. Therefore, option B is the correct answer. If you found this video helpful, don't forget to like, share and subscribe to Digital Medbook. Got questions? Drop them in the comments below. See you in the next video. Until then, stay tuned. Choose